Hello, I'm Dr. William Berger, Medical Director and founder of Northeast Medical Practice.
Good morning, and I'm Irina Berger, Administrative Director and co-founder of Northeast Medical Practice. Dr. Berger, a few weeks ago we talked about injectable anti-obesity medication. We have received multiple questions with the supply and expense for those medications. If there is any alternative options would be for obesity management.
Of course, like we discussed last time, the injectable anti-obesity medications, in particular semaglutide in the form of Wegovy for weight loss, the supply is minimal for the starting doses. Demand is too high and the manufacturer is not able to keep up, so they're focusing on producing the higher doses so that people who are on those medicines already can continue to take them. This is probably going to last for quite a while they ramp up production. So there are other options, and these are oral anti-obesity medications.
And what are the indications for the AOM?
So people with a BMI or body mass index, which is simply a way of easily categorizing people based on their weight using their weight and their height. If you have a BMI of 27 up to 30 and you have an obesity associated medical condition, things like hypertension, high cholesterol, and so forth, then you would be eligible, it would be indicated to use these medicines, although a BMI between 25 and 30 is considered overweight. For folks who have a BMI 30 and up, then they would be eligible to receive these medicines without any of those obesity-associated illnesses.
And what are the benefits?
So the benefits are many. The benefits are similar to weight loss in general. So we can control all those metabolic issues that go with obesity and are actually caused by obesity. And those are the things I already mentioned, such as high blood pressure, high cholesterol, diabetes as well, but different medications might be used for diabetes. These can be used in diabetic patients too. But that's one of the benefits. Another is when folks are using lifestyle measures, and everybody should be using them while they're working on their weight. So nutrition, exercise, getting proper sleep, reducing stress, and so forth, which are really, really important. And we'll talk about those in another video. People who do that and then they lose some weight, their hunger hormone, ghrelin, and we'll chat about that another time too, it goes up because the body wants to try to preserve its weight. So people plateau and then they often start to regain. I'm sure many viewers are familiar with this. So what we can do is introduce a medication at that point, such as one of these oral medicines, to try to reduce that weight gain when people plateau. They can be used prior to bariatric surgery as well to try to get weight down and reduce complications of surgery. And just like I talked about a moment ago with weight regain after plateau, they can also be used after bariatric surgery in order to reduce the likelihood of weight gain, which does happen sometimes.
And can you name what they would approve for long term? I mean, those medications?
Right. So today we're just going to talk about the medicines that are approved for long-term use in managing obesity. And these are orlistat, Qsymia, and Contrave.
Wonderful. And would it be possible to go over each of them and explain mechanism of actions, contraindications? I mean, and also if you could give, the average loss per month, like, I mean, not per month, I'm sorry, maybe, in the length of the course of taking those medications. That would be very helpful.
Of course. So let's start with the first one, which is orlistat. This one has been around for quite some time. It is what we call a pancreatic lipase inhibitor, and in English that means that the enzymes that the pancreas makes to help you digest your fat that you ingest, the production of those is decreased. And so what that means is the fat that you ingest in your diet, a large portion of that is then passed out in the stool. Just to talk about contraindications of all anti-obesity medicines for a moment, so they are contraindicated in both pregnancy and breastfeeding, not just because they weren't tested in that patient population, but because we don't really want to try to have patients lose weight prior to pregnancy. So just bear that in mind for all anti-obesity medications. In terms of when orlistat is contraindicated, so it's decreasing your absorption of fat. So things that are traveling in the fat, you're not going to absorb them as much. So fat-soluble vitamins like vitamins A, D, E, and K, people are going to need to supplement with. And if you already have a malabsorptive condition, so this might be somebody with inflammatory bowel disease like ulcerative colitis or Crohn's disease, or somebody who's had a bariatric surgery where the intent is some malabsorption, like a duodenal switch where they remove a large portion of the intestine. These are folks who should not use these medicines. In terms of adverse effects, you can imagine that if you're passing a lot of stool with fat in it, then you're going to have flatulence, you're going to have potentially some diarrhea, and even to the point of what we call fecal incontinence, where you can't prevent yourself from passing the stool. So these are not insignificant impacts on quality of life. So we basically reserve this medication these days for folks for whom there is not another option. In terms of expected weight loss, the average in the studies, approximately 10%, but bear in mind that's the average, the mean, the middle of the bell curve, if you will. So people are going to fall on one side of the bell curve, people will fall on the other. Some lose more, some lose less, some don't really have a good response. So in general, with an anti-obesity medicine, if we don't achieve 5% weight loss in 3-4 months, then we move on to a different medicine and try that. So the second one we'll talk about is Qsymia. Qsymia is a combination of two medicines in one pill, both of which have been around for quite some time. The first is phentermine, which people may have heard about as a weight loss medicine. In a lot of states, you can only use it for 12 weeks because that's how the studies were done. They just weren't carried out beyond that. The studies were done a long time ago. But studies with this medicine show you can be on it long term. And it acts basically to ramp up the sympathetic nervous system, or the fight or flight part of the nervous system. Because it does that, it can bump up the heart rate a little bit. It can cause some anxiety, some insomnia, and because of that increase potentially in the heart rate, we watch it, but we also don't want to use this medicine in someone whose blood pressure isn't controlled or who has significant cardiac disease. And although it's not an addictive substance, it is in the family of amphetamines, so people who have had issues with substance abuse in the past, just to be extra cautious, we don't use it in those folks. Phentermine has been around a long time, and so has the other component, which is topiramate. Topiramate is an anti-migraine and anti-seizure medication, but it also can help with weight loss. It has an interesting effect, useful side effect of dysgeusia, which is alteration of taste. And in particular, the things that are altered are sugary drinks like regular soda. So often those are a part of the problem with people's weight, and so we can also curb their interest in regular soda by using this medicine. Not entirely clear how it works for weight loss, like many anti-obesity medicines. But in terms of contraindications for that one, it can cause kidney stones, so we don't like to use it in people who have a history of renal stones. Side effects with the topiramate, a little bit of brain fog is not uncommon, and also the stones that I mentioned. And in terms of the expected weight loss that you might have, you can expect somewhere between 10 and 14% on average. But bear in mind that bell curve again. Some people do really well with it, and some people don't have as great an effect. And let's talk about the other medicine that's a combination of two in one pill, and that one is called Contrave. So it kind of goes contra your cravings, against your cravings, if you will. That one is a combination of naltrexone, and the other component is bupropion, which some people may know by the brand name of Wellbutrin. So let's talk about the second one first. It's an anti-anxiety, anti-depression, but also smoking cessation medication. We're not totally sure how this one works either, but it reduces cravings for nicotine, and it seems to reduce cravings for food as well. The mechanism of action of the other part, naltrexone, it's an opiate antagonist, so that means it blocks the same receptor that opiates work on. So therefore, it's contraindicated in people who are on opiates for chronic pain, for example, because those medicines are going to be less effective because the naltrexone is blocking that receptor. In terms of contraindications, so for the bupropion, the Wellbutrin, although it can be used in anxiety and depression, we can't use it in folks who have a history of bipolar disorder because it can induce the manic episodes in those people. Also, it lowers the seizure threshold, so people who are at risk for seizures, like who have a history of seizures, or have eating disorders like anorexia or bulimia, although they may not be seeing a specialist in obesity medicine when they have those diseases. If they've had them in the past, those illnesses also lower the seizure threshold, and so we don't like to use it in those populations. Like a lot of these medicines, phentermine included, topiramate included, bupropion, we don't use them in people who've had glaucoma either. So the adverse effects with these medicines, bupropion, maybe a little bit of lightheadedness, a little bit of nausea in the beginning, but bear in mind with all these combination medicines, we can use a lower dose of each component than we would if we were using one by itself. So side effects from these medicines tend to be lower than when they're used as solo agents. And maybe a little bit of a bump in blood pressure and heart rate, but very, very small, like 1 or 2 beats a minute on the heart rate, for example. Naltrexone, really no side effects, just can't use it in folks who are using opiates chronically. Those are the main things. There are a few others that are a little bit more rare. In terms of expected weight loss with Contrave, 7% in the literature, but 10+% is really more like the average. And some people it works well, some people it doesn't, but it also has the added benefit, perhaps, let's say the patient has anxiety too, this would be a good medicine to choose because the Wellbutrin part is going to help them with anxiety. Similar to Qsymia with its topiramate component, if the patient has chronic migraines, it might be a good choice too. So you can get this 2 birds with 1 stone kind of situation.
Wonderful, wonderful. Your knowledge is incredible. I mean, let me ask you, I mean, all your knowledge comes from medical school, or this is from your recent studies for obesity management certification and so forth?
Really very little of this is covered in medical school, at least when I was in medical school. It's starting to trickle into the curricula now, but no, as you mentioned, all of this really comes from my work with the Obesity Medicine Association, which is one of the significant organizations, medical associations in this country for people who practice obesity medicine, whether it be a part of their primary care practice or if they're acting as obesity medicine specialists only. So it's a great organization, has tremendous depth of training that's available to you, which I've participated in, and also they're very proactive in terms of trying to help people understand that obesity is a chronic disease. And so the question I'm often asked is, doctor, if I'm going on this medicine, how long will I have to be on it? We need to treat like we treat blood pressure, like we treat diabetes, cholesterol. Although some folks, if they can do enough lifestyle changes, they may be able to come off the medicine or decrease the dose. But just like with blood pressure, if you go off your blood pressure medication, you may no longer be controlled, it may increase. So we do have to think about it long term, and the OMA has really been at the forefront of helping doctors and the public understand that we need to look at obesity as a chronic disease.
Wonderful. And this is very, very helpful. Thank you. And do you have any conclusive remarks?
So just in general, I would say the oral anti-obesity medicines are great options for people who, for whatever reason, can't obtain or can't be on one of the injectable medicines. For folks who have concomitant medical conditions like anxiety, migraine, and so forth, and we can treat two things at the same time with one medicine. They can be used together, and we can get some kind of synergy between them. They can be used before and after bariatric surgery. So really a lot of applications for these medicines, particularly in this time where some of the medicines that have a little bit more of an effect on people's weight are not available.
Wonderful. And would you like to read disclaimer and do we?
Of course. So just bear in mind that these videos are all for educational purposes only. They don't constitute medical advice. We have not formed a doctor-patient relationship, and you should not hesitate to contact your physician or other medical provider for questions or any issues medically that you might have. If you'd like to learn more about all of these subjects, please, you can reach out to our website, which is www.northeastmedicalpractice.com, or you can call us at 516-604-3418, and we'll be happy to speak to you further.
Thank you.
See you next time.